Mustafa, we are with you. Hello. Actually, यहाँ पे जो
ये आपका है IVC I think yeah let me see that's probably aorta. That is part of your liver and there's a ascites behind it. So actually what I'm doing is I pushed in and I'm actually having to flex down so I'm against this lesser curve, the back wall. And now as
Mustafa, we are with you.
okay, so we just I can't remember the age of this lady, but basically 55 with a jaundice bilirubin of 18 or 19 with I think they've seen a bile duct stone, but also there's concern for a stricture in the bile duct with no extrahepatic biliary dilation. But we're still at the stage of being in the G junction and just identifying structures. So I have the scope right now, but I'll be handing it back in a second. There's one finding that caught our eye right away, which, if I can reproduce it, is right here. So I wonder if any of the candidates would consider commenting on this. Right. So did you hear that? Can you hear us?
Yes, we can hear you.
Okay, so any of our candidates want to hazard a guess what this is?
They say it's ascites.
Good. So ascites, which, and also I forgot to mention she does have a history of hepatitis C as well. So anyway, I'm going to hand the scope back. We're going to next look for the aorta slash celiac access.
So what was the basic mistake?
There is a no. I don't think you made a mistake. But look for the aorta. I think you're fine. So I think it's just that hiatal hernia. We're getting stuck in that hiatal hernia. So as long as you're past it. Now the hiatal hernia may be the area where the celiac may be most obvious too. So you want to, for now, this is one of those where you have to try and find a structure that you can identify with. And the one that we're looking for obviously is the aorta. And the question is how easy or difficult is it going to be to find it? So what you need to do is relax this and then with your left hand drop it down, bring it up. So you're scanning the area looking for the aorta.
So I think this is aorta.
I think that's your ascites again.
Okay.
See, there's no flow in that.
Right.
So I think what you want to do is again endo karne zara ek second, wo galat wala button. So get through your hiatal hernia. Here we have to be careful not to, because there's some trauma there now.
Right.
So hanji ultrasound kar and go clockwise. So my suggestion, pull this, yeah, there you go. Step back and hold, just support, and now keep spinning to see if you can see aorta. Go counter again. Okay, right now it's obviously not the aorta area.
This is situs again.
Yeah. So move your hands, right? You can't stay still. Do this. Do this. See? Movement. This is ultrasound. This is not ERCP, right?
Right.
So push in a bit. See if you can figure out. That to me looked like maybe spleen, but I really can't tell. Let me take over for a minute because this is not obviously that straightforward. Take care. Nahi sahi hai. So now we're starting to see a vessel, right? This looks like a vessel.
Right.
So I'm going to follow it back And as I follow these vessels back, now I'm starting to recognize structures from my memory, not necessarily anything obvious. Right, and what are the two vessels at the top?
Splenic artery and splenic vein.
Okay,
The
good. So
one
the
which is closer to the transverse artery.
good. So that's artery. So now maybe if we follow it back, perhaps we can follow it to the splenic artery, celiac artery, and aorta. Now here you can see a vessel that's coming off
Right.
what looks like the aorta, right?
Exactly.
So that's the thing. When you get lost,
Okay.
get into like proximal to mid stomach, start scanning, and start looking for structures that you may recognize. Once you've done that, then you can start going one way or the other. So in this situation, now that we have the pancreas in view, what I'd like you to do is you can take over and then
Alright.
follow see if you can identify the pancreatic duct. So generally, go ahead, sorry.
बेटा कैमरा जो है ना उसको अगर तुम उसके स्क्रीन के ऊपर फोकस करो and let's see how the vision is because there in that room it isn't that bad.
Yeah, which can
इनसे कहेंगे फोकस करें उसको स्क्रीन को जो आप जिसको मूव किया है just leave it there.
अच्छा sorry.
Then they can focus it and see if they can give me a view of that. हाँ स्क्रीन को करीब ले जाएं. No, actually not good at all. Actually this is better.
Okay.
छोटा करके रखो फिर इसको.
Here is the splenic conference with
इसको आप
Right.
स्क्रीन को जैसे पहले किया था आप उसको छोटा कर दें
lower
प्लीज.
one is portal.
नहीं इसको हटा दें रूम में. Go back to
Right is portal.
looking at Dr.
Right.
Mustafa
Exactly.
please.
So now go clockwise and see if you can follow the pancreatic duct.
Exactly. I can't see the pancreatic duct. Right.
Yeah, relax your big wheel. So thumb away from you on the big wheel and go clockwise. And now you may or may not, but she may have a very normal, small appearing pancreatic duct.
Right.
And she has a lot of fat. The brightness tells you that there's fat inside.
Right.
So
We
that
are
makes it,
splenic hilum.
so keep going clockwise because you still have pancreas. I'm just going to put the cursor on for,
Here's the left kidney.
so this is still pancreas.
Right.
So, and this,
This thing.
so keep going clockwise. What's this structure coming into view?
Right. So here's the spleen, right?
Yes, very good. So
Okay.
we have the spleen here.
Right.
Relax your big wheel because you're pushing. Whenever you start seeing compression of the vessels, that means that your probe is pushing down on the structure.
Right.
So at that point you have to relax. There you go. And here now you may make out the pancreatic duct. It's not relevant to this case.
Okay.
So we can generally move on now. So go counterclockwise towards the bifurcation again. Sorry, the spinoportal conference. And there is maybe PD, but
Yeah.
this structure here may be the PD. Vessels can also fool us in these such situations. So just for the audience, can you show us the conference again? Because earlier you showed it to me. So go counter. So left, so push in and left. And then there you go. And then keep, there you go. Excellent. So and here's our conference coming in. Right there. Okay? Yes, right there. So portal vein, SMV, and splenic vein. And the splenic artery. These two, splenic artery and vein again. So they'll communicate.
Right. Splenic vein is different from this tissue.
I think this is different. Yeah, take a look.
No.
See if they. No, that's the splenic artery actually. It's just the artery
Right.
twice.
Right.
So this is more upstream and this is lower down,
Right.
and that is the vein.
So identify the structures. Pull back a little. Identify the structures.
Okay, we are with you.
Okay, great. So we intubated the patient. She was desaturating. Her airways were causing a problem. She's stable.